Hey there, my name's Melissa, and I'm a licensed therapist with Happy Moms Therapy. Today, we are going to be talking about postpartum depression, and I'll be answering some common questions I get on it. So, the first is what exactly is postpartum depression? So, postpartum depression, which is also called perinatal depression, is basically depression that occurs during pregnancy, postpartum, or post loss. Postpartum depression can occur not just in the pregnant and birthing person, but it can also occur in the family members, including the non birthing partner, which also includes fathers. So, some of the common symptoms of postpartum depression is feelings of irritability and anger, including rage, feelings of sadness, feeling numb or kind of just not feeling your emotions, tearfulness, appetite and sleep disturbances, feelings of guilt, shame, worthlessness, loss of interest in activities you used to enjoy, difficulties concentrating and paying attention, kind of like a disconnection from your baby or feeling like you can't form a connection with your baby. Feelings of anxiety is a big one in postpartum depression. Um, Having intrusive and or scary thoughts of something bad happening to you or your baby or a loved one, thoughts of harming yourself or harming your baby. And also sometimes it can include changes in your substance use patterns. So it could be drinking more alcohol than you normally would. As you can see from some of these symptoms, that these can kind of be hard to tease out with postpartum because for one, you're gonna have sleep disturbance anyways. Baby's gonna be waking you up a lot. You might have an appetite change, especially if you're breastfeeding. You might be feeling a lot more hungry. Tearfulness can be common in those early weeks after baby's born because there's going to be this changing in your hormones. So some of this can be hard to figure out: is this normal or is this postpartum depression? The next question is, what are the baby blues and how are they different than postpartum depression? So you may have heard this, the baby blues. And baby blues is basically a term to describe this really highly emotional time after you give birth. It's commonly linked to the hormonal changes that are happening during this time. And it's very common to just feel, a lot more intensely emotions and to be tearful. You may have bouts of sadness, worry, uncertainty, and overwhelm. Typically, these kind of feelings start up around 2 or 3 days after giving birth, and they'll usually last for around 2 weeks, and then they will kind of go away or start to get better. The big difference between baby blues and postpartum depression is that with postpartum depression, it doesn't get better after those 2 weeks. And you're going to probably start to feel it more intensely. And with the baby blues, these feelings can kind of come and go, whereas postpartum depression, there can be this overall feeling of kind of this like loss of enjoyment, this like deep kind of fatigue, a lack of joy that can also come with postpartum depression. The next question is, are there other kinds of postpartum mental health struggles? And the answer to that is yes. Oftentimes, people refer to postpartum depression and may actually be referring to a different type of mental health struggle that is coming up in the postpartum time. We now have a more umbrella term to refer to all these, and that is called perinatal mood and anxiety disorders, or also known as PMAD. So this is the group of mental health kind of disorders or struggles that can come up in the postpartum time. So this can include not just depression, but also anxiety, OCD, which stands for obsessive compulsive disorder, bipolar, psychosis, and PTSD. The next question is, how common is postpartum depression? So actually, both the baby blues and postpartum depression are quite common. For the baby blues, up to 80% of moms report feeling mild to moderate feelings of sadness during those early weeks after baby's born. And then for postpartum depression, about 1 in 5 moms will report experiencing this. I often think that whenever we have these sort of stats that are reported upon, that the actual incidence is likely to be higher because these are things that can be hard for women, mothers to talk about. And so often it can be kept secret. So while we might have this reported 80% of moms experiencing the baby blues and 1 in 5 moms experiencing postpartum depression, I would likely think that it's higher than that. The next question is, how do I know if I have the baby blues or if I have postpartum depression? So typically within with the baby blues, these are going to happen within a few days after giving birth, and they typically will last up to 2 weeks postpartum. They don't continue past that 2 week mark. With the baby blues, it's going to be lower in severity. You might still feel kind of at times this intense emotions and sadness and overwhelm, but it's going to kind of come and go. And that it will naturally go away on its own as your hormones start to adjust after birth. With postpartum depression, this will happen or will continue after the 2 weeks post birth, and the symptoms are often felt at a higher level. It's also something that it's sort of more encompassing. So, again, there might be an overall feeling of just like not being able to find any sort of like pleasure or joy, really like not feeling anything, like a apathetic kind of feeling, and also can include a lot of anxiety that we see in postpartum depression. So if it's been more than 2 weeks since you've given birth and you've been experiencing some of these symptoms, it's possible that you have postpartum depression or another perinatal mood and anxiety disorder, and I would highly recommend for you to seek out support. The next question is, what causes postpartum depression? And just like your regular depression, it's thought to be caused by a multitude of reasons: genetics, past experiences, current stressors, adjustments to caring for a baby, sleep deprivation, and hormone fluctuations are all thought to play a role. Previous experiences with depression and other mental health struggles are often linked to a higher possibility of experiencing postpartum depression. How long does postpartum depression last? So there's really no average length of time. It can depend on a variety of factors for how long it lasts. But if left untreated, postpartum depression can last anywhere from several months to several years. Some moms report improvement in their symptoms over time, um, with a resolution in 3 to 6 months. However, other moms report continual symptoms well past 6 months, with over half of moms still meeting the criteria for postpartum depression over a year after they gave birth to the baby. So, as you can see, it can be a very wide range. There is a 2-year study of moms with postpartum depression, and many of them report a peak of symptoms around 4 to 8 weeks after delivery. And again, even with that study, there were a good amount that still reported scores of depression over 2 years past delivery. So, my interpretation of this and what I see with my clients is that there's often this peak of more intense symptoms after giving birth as they're going through these huge adjustments with baby. There is sleep deprivation that's been going on now for 1 to 2 months, and it's really starting to catch up with them. They're trying to make sense of this new life. They're trying to sort out all these new tasks and how they are going to do that, depending on the health of the relationship they have with their partner. That's also going to make a big difference in their symptoms or how they're feeling in that time. Over time, what I see is that many moms start to adjust to the demands of motherhood. And, as baby gets older, they'll slowly start to get more sleep, which certainly helps a lot. But I think that is really kind of what speaks to the severity of symptoms coming down, that you kind of have that peak at 4 to 8 weeks. And then as they're adjusting, as they're starting to get more sleep, as they're kind of developing some like momentum and understanding of like what this life is now with baby, they start to get used to it. However, as the study showed, that even 2 years after birth, these moms were still experiencing symptoms of depression, because while these moms maybe adjusted and got used to these new demands, they still probably had very little support. Our society does not support moms well. We don't have, like really good, affordable childcare. A lot of moms struggle with whether they continue in their career or if they stay home. Their careers and jobs aren't supportive of them wanting to be around more and have more of a balance. There's often a huge struggle in their relationship on how do they balance all these needs of baby, how do they take care of all these new things, and also how do they prioritize their relationship. Mothers are also often very isolated. We don't have this big support network anymore. There is no village that's helping. So I think all of those things are really impacting. And that is why even 2 years after a woman gives birth, they're likely to still experience some of these symptoms of depression. So I see it a lot. And I have a lot of moms that might come to me and now their baby is now 2 or 3 years old, but they're still feeling depressed. And they'll say, I think I had postpartum depression and I've just never really gotten over it. The next question is, should I get help for postpartum depression? Yes, absolutely yes. Even if you aren't sure if you have postpartum depression, if it's just the baby blues, or maybe you're just struggling with the transition of this postpartum time, getting that extra support can be a huge game changer and can really make a difference for yourself long term. Most moms I work with, myself included, we don't look back and think, I wish I waited longer to get help. It's often, I wish I would have gotten help sooner. Maybe it wouldn't have gotten so bad. Maybe I wouldn't have struggled so much. So, if you are finding yourself struggling, feeling overwhelmed, disconnected from yourself, or just stuck, I just highly encourage you to reach out and get support. If you are in California and you're interested in my services, you can reach out and we can schedule a free consultation to see if it's a good fit. I'll be putting some information on how to do that at the end. And the last question is, what is the best treatment for postpartum depression? So the answer to this is really going to be, it depends. The best treatment for your postpartum depression is really going to be dependent on your symptoms and your situation. For some, this may include medication support. There are some very good and safe medications that you can take during postpartum depression, during the postpartum time, even when you're nursing. And so if this is a route you think you may need, then I'd highly recommend that you reach out to your OBGYN. And, for others, while medication can be helpful for some women, for some other women, it's not a route that they want to take. And really what can be really helpful is therapy. And even if you do take medication, therapy can also be really helpful. And I always recommend therapy. So it can be important if you are going to seek therapy is to get a therapist that specializes in postpartum, in the postpartum time. They're going to understand a lot of the nuances and the different things that are coming up that are very specific to that postpartum time, as opposed to someone else who might be treating more generalized depression. And so I would highly recommend that you kind of search for a postpartum or a perinatal therapist. For myself and how I treat my clients for postpartum depression is we're going to kind of look at some of the basics at first. And these are the things that we really focus on is making sure that they're getting enough sleep. And sleep can be so hard to come by in that postpartum time. And I really recognize that. And sleep is imperative to our overall well-being, including our emotional wellness. Sleep is what helps us be able to regulate our emotional experiences. So it makes sense that when all of a sudden you're not getting sleep, your sleep is constantly disrupted. The longest maybe sleep you can go for is like an hour and a half, maybe 2 hours. Then yes, you're going to be emotionally dysregulated, emotionally off. So really working on my clients on how they can get more sleep is something that, I typically is like the first thing I start to address in therapy. We also look at the relationship with their partner, if they have that, and ways they can get better support from their partner. or or if they don't have a partner that's available, then if it's some other families or other support person. We also look at feeding baby. A lot of times there can be a lot of struggles that come around feeding baby. So really look at that. How is that going? What is their internal beliefs around that? Is what they're doing, is that what's best for them, not just what's best for baby, but what's best for them and baby as a whole. We also look at self-care. So really about how they can start to take care of themselves during this time. As with baby has so many needs that it's very easy to put yourself last. But this is one of those periods of time where it's really important to take care of yourself. So those are some of the kind of like the basics that I start looking at with my clients around what's, to help them with those things. And sometimes just by targeting that stuff, they start to feel better. Other times there might be some other things going on. And especially for those that have experienced depression or anxiety before being pregnant and having the baby, there might be some past things we need to look at. If they've had any sort of trauma, whether it's, as a child or at other points in their lives, or even within their birth experience, then we may start to address that. If there is trauma in your life, including birth trauma, I highly recommend EMDR therapy, which is something we also provide at Happy Moms Therapy. And so we can start to kind of dig a little deeper after we kind of meet some of those basics. So anyways, I hope this was helpful for you. As I mentioned before, if you are in California and you're interested in my services, please don't hesitate to reach out. I do accept new clients. And also, if you're not in California, or even if you are and you just want more support, I have a postpartum support plan. It goes over some of these common pain points, is what I call them, in postpartum time. And it gives you sort of some strategies and a plan of what you can do to help yourself with them. So you can find that as well in the link in the notes about this video. So take care.